Over the summer, a respiratory virus other than COVID-19 spiked, and those numbers are still on the rise.
Fox 12's Bridget Chavez spoke with a pediatrician from OHSU and explains, though, why RSV cases in children could be an indirect effect of the pandemic.
Dr. Eliza Hayes-Bakken tells me this rise in RSV cases in children is likely because of the pandemic, but it's still too early to determine exactly why this is happening, but says it could be because last year kids were mostly kept home when they normally would have been exposed to it from daycares or on the playground.
That's left a larger group of kids having had this year experiencing their first RSV infection at kind of older ages than we would usually see.
According to data from the Oregon Health Authority from November 1st of 2020 through January 2nd of 2021, there were only 5 cases of RSV in the state.
So certainly, we had a very unusually low year last year, very, very, very few cases of RSV.
But those numbers have skyrocketed this year. OHA reported 122 cases for the week of November 7th through the 13th. Bakken says they typically give a medication called Syncytial to patients at high risk of RSV beginning in November, but this year they started prescribing it in October. And last year, they didn't give any.
We tend to usually have later RSV seasons, so starting Syncytial in kind of November, December even sometimes, and kind of seeing it peak in December, January, sometimes even as late as February. Each year is a little bit different.
While that medication can help prevent RSV, there is no cure. Bakken says it's important for parents to be on the lookout because RSV can set kids up to develop secondary bacterial diseases and make them really sick.
So definitely possible for a bacteria to kind of climb up in there and set up shop in an ear or in the lungs and cause a pneumonia or an ear infection. And so when those things happen, sometimes we do need to use antibiotics to kind of turn a child around.
Bakken says symptoms of RSV are similar to COVID-19, and the best way for you to know the difference is to get your child tested. In studio, Bridget Chavez, Fox 12 Oregon.